Well, we've enjoyed watching this graphic over the past few weeks now as the number of cases decline in the United States and the United Kingdom. Looks like there might be a bit of a levelling off there in the States, but when we look at the amount of testing, we see the testing in the UK is fairly buoyant, but in the United States it's gone down. Less testing being done in the United States, and this means that that number is a bigger underestimate than the UK number is an underestimate, because there's less testing being done in the States. So is that a levelling off? Is there a slight increase now, as we had anticipated in March in the United States due to the new variants? Quite possibly. We don't quite have all the data we need to decide that because of this reduced amount of testing. Other countries to keep an eye on over the next few days: Czech Republic increasing cases, Malta, Hungary and Jordan both increasing. And I just put the United Kingdom in there as a comparator. Welcome to this talk. It is Friday the 5th of March. Now, some news from Europe first of all, some quite important things really, and then moving on to the Americas after that. So let's get straight in with the UK. Vaccines, as of today, we should reach 21 million first doses and 1 million second doses of vaccine given. So good, excellent progress is being made. Cases in the past 7 days, over the past 7 days, 46,796 new cases. Still a lot, but down 34%. And I think we'll just look at the COVID symptom tracker data there, which gives us quite a good idea. So still 136,000 people infected in the country, so it's not gone away. 8,108 new symptomatic cases in the day. And here we see the evolution of the overall prevalence. So we see that the steep decline has stopped. The decline is there, but it's not as steep. But we still have a relatively high prevalence. So 4th of March, that was yesterday, 136,007 symptomatic cases in the UK. So yes, the direction's good, but the case numbers are still relatively high. Deaths over the last 7 days, another nearly 1,800 people have died, unfortunately, taking the total up to 124,000, albeit down 33%. Will continue to go down. No question it will continue to go down because the cases have gone down. Deaths on the death certificates higher, 140,000. This is the number of deaths within 28 days of a positive diagnosis. Hospitalizations. Well, I mean, there's still another 6,500 people admitted to hospital, albeit down 29%. So it's all very good looking at these downward trends, and they are wonderful, but the numbers of cases are not low by any means. Now, story from the UK, from the Office for National Statistics: over 80s not behaving themselves. And it's serious. Office for National Statistics, over 80s breaking the rules. Now, uptake in the over 80s has been 99%. Now, this is staggering. What this is saying, in people over the age of 80 in the UK, 1% of them haven't been vaccinated. So there was a lot of talk earlier on about vaccine hesitancy, and it's still there, but I've never really talked about it much because I anticipated it would diffuse away as the success of the vaccine programme becomes patently obvious. And I believe that is the case. So I'm still not going to really address that because I don't want to give credence to it at the moment. We'll address it if we need to, but at the moment, 99% of people are taking up the vaccine. That is quite incredible. 2 doses now, up to 15% of the over 80s. 49% perceive coronavirus to be a major significant risk to them personally without vaccination. To put it another way, it looks like 51%. I don't want to put words into the mouth of the Office for National Statistics, but 51% seem to think that without vaccination it wasn't too big a deal. So in the over 80s there, some pretty poor levels of understanding, it has to be said. If 51% don't seem to think it's a significant risk to them, because patently, as we know, the older, the greater the risk. Now, 2 out of 5, 41% of over 80s who had received the first dose of a vaccine less than 3 weeks ago. So full immunity not by any means kicking in yet. So 41% who'd received a vaccine less than 3 weeks ago reported they'd met someone outside their household other than a household member, care worker or member of their support bubble. So 41% of people who've had the first vaccine within 3 weeks are patently breaking the rules. And this is just not on. Wisdom does not always come with age by any means, in my experience. I was surprised. Now, even after 3 weeks, they should still be obeying the rules because the rules haven't changed for people that are vaccinated. But before 3 weeks, they're not really enjoying a significant level of increased immunity because that takes 3 or 4 weeks, as we know, regardless of the vaccine. It takes time to build up. So rule breaking going on amongst the over 80s. And these meetings occurred indoors. So, what to say about that? Over 80s breaking the rules, 41% of them. And it looks like, and from the Office for National Statistics, knowingly so. I don't know what to say about that, really. I'm surprised. It's not good. You know, the attitude that I'm protected, therefore I can do what I want. That attitude is not what we want at all. Apart from the fact that they were wrong, they misunderstood that they weren't protected for the first 3 weeks. And we looked at this with the Israeli data, where cases actually increased in the first week after vaccination. That's just the facts. On better news, after one dose, 25% or more of over 80s, much more likely to attend hospital if they needed to, so that's good. We know that people have been dying through not attending hospital. 2 doses, 33% of over 80s, much or somewhat more likely to attend hospital, so that is encouraging. Regardless of your vaccination status, all serious medical conditions or conditions you're uncertain about need a medical opinion. And it's been sad that so many people have been reluctant to go to hospital. Remember, I'm talking to colleagues on accident and emergency during the very start of this. They couldn't work out where all the patients had gone. And the answer is many of them we now know weren't being treated when they needed to be. So good to see that there's increased confidence of hospital there. Now, Germany, UK variant. This is how this wretched variant grows and how it caused, let's just remind ourselves, this is what it caused this in the UK. That was caused by, that steep incline there was caused by the new UK variant. Now, unfortunately, this is what we're starting to see in Germany. Now, 4 weeks ago, the UK variant, the B117, the 2012, the Kent variant, whatever you want to call it, was 6% of cases. 4 weeks ago, 6% of cases. Now it's at least 40% of cases. So it's gone from 6% of cases to 40% of cases in a month. And it's going to carry on going up till it's much more than that, probably 90% of cases. Robert Koch Institute director, I think. It's foreseeable that B117 will soon be the predominant variant in Germany. Yes, it will. It will be even more difficult to keep the virus in check. Yes, it will. Because the B117 is more contagious and even more dangerous in all age groups. Not my words, direct quotes from the director of the Robert Koch Institute in Germany. And as we've said, we're worried about other countries in Europe as well, and the United States in terms of new variants. I was actually going to report later on the new variants in the United States, but the website was hopelessly out of date and patently inaccurate, so I just didn't bother. Basically, we haven't got data on that in the States. Now, better news, compliance with the evidence base. Denmark, giving Oxford AstraZeneca vaccine to everyone aged over 18. Good, better late than never. Germany, making it available to over 65s. Good, better late than never. France, health minister. This is good news for an elderly person waiting to be vaccinated. It's now going to go to the over 65s. They can now be vaccinated faster. Good, better late than never. Greece, Sweden, Belgium, likewise. Spain, come on Spain, move with the evidence, still thinking about it. So quite frantic backpedaling there from Europe. And it's exactly what we were saying on this channel 2 weeks ago, because this information was available in the public domain and we managed to work it out, whereas all those countries apparently didn't. Hard to understand. We worked it out from what was in the public domain. Not difficult. It was in the phase 2 and the phase 3 clinical trials. It was there for everyone to read. And of course, the agencies in these countries and the European Medicines Agency, which is strangely silent on this, it has to be said, they have much more information than we do. And yet it's taken all this time, but thankfully it's got there now and lives will be saved as a result of that policy change, there is no doubt. Italy postponing elections till after summer, just local elections, but still quite a big step. Blocking a shipment of 250,000 AstraZeneca vaccines to Australia. So this is part of the Brussels Export Transparency Programme. Good to be transparent. And Brussels has approved the blockage. Now this is agreed contracts between Australia and AstraZeneca, as I understand this, that have been blocked. I'm not going to comment, I'm going to let other people do it. AstraZeneca production sites in Italy, Belgium, Netherlands and Germany. So this is being produced in different places in Europe. One of the great things about the AZ vaccine is it can be produced in many, many sites. And the irony here is we believe Italy has 1.5 million doses of AstraZeneca vaccine in stock. And we believe they've administered under 1/3 of them. So where's the other 1.2 million doses just sitting in a fridge somewhere? Let's hope they're used before they become expired, because of the very slow rollout of the Oxford AstraZeneca vaccine, and now all of a sudden blocking agreed contracts, or as we understand it, agreed contracts to Australia. Greg Hunt, Health Minister in Australia. Australia has raised issues with the European Commission, I'm sure they have. They want this to be reviewed and they want assurances that no further shipments will be blocked. So they're going to review that, we believe. So very diplomatic there from Mr. Hunt. Simon Birmingham, Finance Minister. Less diplomatic, more forthright. The world is in uncharted territory at the moment, true. And it's surprising that some countries would tear up the rulebook. So much harsher language from Mr. Birmingham there. I really hope this is not the start of vaccine nationalism that we've feared for some time. Leave that there. Right, Cyprus. Now, this is interesting. Cyprus is going to allow entry to vaccinated British tourists in May. Now, we probably won't be allowed out till late May or June, but they're allowing that. Vaccinated Brits. Now, this means there'll have to be evidence of their vaccination status. And that presumably means that will have to be provided by the UK government. That means there's going to be after some way to differentiate between the vaccinated and the unvaccinated. This is quite inevitable. It could well be an app on your phone. So in order to travel, you will have to download this app. If you don't want to download the app, that's fine, but you can't travel. Take your pick. I think that's the way it's going to be. Israelis can go to Cyprus from next month. Lucky for them. Okay, again, evidence of vaccination going to be needed. And we know Israel is already working on a green electronic passport of some sort. We don't know the details. Canada. Now, more on Canada. We're talking to Lindsay later today from Canada. But British Columbia, 4-month interval for the Pfizer and Moderna vaccines between the primary dose and the booster dose. So longer than the UK. Quebec a 3-month gap. So we'll follow that data closely. Interesting. But that's how they're kind of eking out their supplies. Now, Brazil. President Bolsonaro told people to stop whining about COVID-19. President seems to have difficulty supporting the lockdown measures. So people should stop whining about it and get on with their lives, seems to be the message. From the leader of a large country. Meanwhile, back in the real world, cases in Brazil yesterday, 75,000. Day before that, 71,000. Over 10 million people now. Deaths yesterday, 1,699. Deaths the day before that, 1,919. Deaths before that, 164. 261,000 deaths. Imagine that, and the Brazilian people are whining. Dear me. It's just this detachment that some world leaders seem to be in is just... Deaths are up 25% in the past 2 weeks. It's the worst time in terms of deaths for the pandemic in Brazil. No sign of it falling off quickly. Hospitals and intensive cares are absolutely crammed beyond capacity in some areas. Deaths are up 25% in the past 2 weeks. And the president says stop whining. P1 variant first detected in Manaus. The Amazonian variant, of course, is driving a lot of this transmission. So let's spare a thought for the suffering, real suffering of the people in Brazil. Still in the Americas, Honduras, 4.2 million doses of Sputnik V arriving. So that's good. That will get the vaccination program off to a nice start. But delays to the expected Covax vaccine. So let's hope this isn't started problems with the Covax UN/WHO program. Government has also ordered 1.4 million doses of AstraZeneca vaccine in Honduras. So, and of course, we've looked at the phase 3 data on the Sputnik V, the Sputnik vaccine, and it was very efficacious and very safe from the phase 3 clinical trial data. Right, United States, CDC. Cases, another 65,000 cases per day. Let's just look at this actually on the graph here. So yeah, it's gone down a lot, but we're still at, that's the 50,000 line there. Daily new cases. This is still high. And the deaths in the States have come down remarkably slowly and actually seem to have leveled off now. We had thought this was artifactual at first, but this seems to be the way the numbers are now at the moment. So, and of course, unfortunately, the new variants will be having a big impact in the States in the next few weeks. Or we know that is a real risk that they will be having a big impact in the States in the next few weeks. So it's far from over. Last 7 days, nearly 437,000 new cases. That was the cases in the last 24 hours. 29 million officially diagnosed. Deaths up by 1,947. Again, high numbers of deaths. Let's just remind ourselves of those. It's this is it here. So again, the deaths have come down, yes, but this is this line here is the 2,000 deaths a day line. These are high numbers of daily deaths. Still been going for so long now in the States. Deaths now up to, is that right? 571,000. Dear me. That sounds high. It seems no time since it was going over the 500,000 mark. So, still, the United States in the grip of a pandemic, no question about it. Now vaccinations going fairly well. 54 million have had one dose. Now, that is 21% of the population over the age of 18, which, of course, is the current target population. 16.3% of the total population. And we know that younger people and children will be vaccinated in the States later in the year or early next year. Or we believe that's going to happen. 2 doses, nearly 28 million. That's 10.9% of the population over 18. 8.4% of the population as a whole. So 21% of the population over 18, 16.3% of the whole population. So a ways to go, but the direction is good, and roughly it's about 1.75 million doses per day being given out in the States now, and that will accelerate. Now, buoyed on this good news, Texas and Mississippi have been reducing the restrictive measures. And Dr. Fauci's been commenting. I don't know why they're doing it, but it's certainly, from a public health standpoint, ill-advised, inexplicable. Direct quotes from Dr. Fauci. So clearly he's not agreeing with the policies being implemented in Texas and Mississippi. Right, better news. California. San Diego Safari Park. Now, we did notice in January that, I can't remember, was it about seven or eight of the gorilla troop did contract SARS coronavirus 2 COVID-19 from one of their infected keepers. Thankfully, all made a recovery. That they sort of slowed down, became lethargic and tired, and started coughing, very similar to humans. Anyway, it looks like the whole troop has now been vaccinated, so that's good. And 4 orangutans and 5 baboons already had 2 shots as well. So delighted to see these amazing, wonderful animals are being well looked after and vaccinated. Of course, the other thing it brings to mind here is the this kind of reverse zoonosis, really, into other animals. So, wild ferrets are a concern, for example. Could there be an animal reservoir? Probably not, but we don't really know yet. Now what we've all been waiting for: World Health Organization report on the origins of the virus in China. So it looks like we're all going to find out any time now exactly how this pandemic started, from the special team from the World Health Organization that went to Wuhan to investigate this very purpose on our behalf as part of the World Health Organization. Interim report we were expecting about this week, but we're not getting one. Oh, no interim report. But a full report's being published in coming weeks. So then we'll know, won't we, how this pandemic started. Would be nice, wouldn't it? Would be very nice. Anyway, we have to carry on holding our breath. No interim report. New Zealand, good news from New Zealand. Now, you might remember we did report on this at the time. There's 15 community cases of the B117 in February. Well, they're starting to ease the lockdown in Auckland now, starting on the 7th of March, so a couple of days' time. So, looking more promising that New Zealand have prevented entry of the virus again, as Australia have several times. So excellent news. Well done, New Zealand. I think that's us for today. Thank you for watching. Now, Winston's slightly embarrassed because he knows he should have 13 stripes on the mask and he hasn't quite got enough, but he's trying, so that's fine. He's trying to show solidarity. The number of stars is correct, so I did check that. So that is us for today. Thank you for watching, of course.